I'm about to share something that surprises many of my patients, especially those who believe nighttime is a period of rest and stability for blood sugar. After years of working with adults over 60 who live with diabetes, I've learned that what happens to your blood sugar while you're asleep is often far more dangerous than what happens during the day. Most people assume that blood sugar remains steady overnight. After all, you're not eating, you're not moving, and your body seems calm. But in reality, your blood sugar is anything but quiet. For millions of older adults, glucose levels quietly rise, spike, and fluctuate during the night, damaging organs, accelerating complications, and doing so without any warning signs. Your doctor likely told you to check your blood sugar in the morning and maybe before meals. That advice is common, but it leaves out a critical window, the 6 to 8 hours between bedtime and waking. During those hours, powerful hormonal and metabolic changes are taking place. Almost no one is monitoring them, and almost no one is talking about them. The danger is that this damage is invisible, until it isn't. One day it shows up as declining kidney function. Another day it appears as nerve pain, numbness in the feet, or blurred vision. By the time symptoms appear, years of silent injury may have already occurred. By the end of this series, you'll understand why blood sugar rises overnight, what may be happening inside your body specifically, and how to have smarter, more productive conversations with your healthcare provider. This is not about self-treating or changing medications on your own. It's about understanding the physiology so you can protect your long-term health. Before we go any further, I need to be very clear. Everything I share is for educational purposes only. I am not your personal physician, and this information should never replace professional medical care. Never change or adjust diabetes medications without consulting your doctor. Insulin changes, in particular, can be life-threatening if done incorrectly. My goal is to help you become informed, not independent of medical supervision. Let me introduce you to a patient story that may sound painfully familiar. Margaret was 68 years old and had lived with type 2 diabetes for over a decade. She followed her treatment plan carefully, took her medications as prescribed, and monitored her blood sugar faithfully. Every night, her bedtime reading looked reasonable, usually in the 130s or low 140s. Her dinners were controlled, her portions modest, and she never snacked late. Yet every single morning, she woke up to numbers in the 170s or higher. She was doing everything right and still waking up discouraged, frustrated, and afraid. Like many patients, she was told her diabetes was simply getting worse and that more medication would be needed. But Margaret knew something didn't add up. She wasn't eating overnight. So where was that extra glucose coming from? That question, why blood sugar rises while you sleep, is exactly what we're going to start answering next. When Margaret sat in my office, she wasn't asking for another prescription. She wasn't looking for shortcuts or miracle fixes. She wanted something far more important, an explanation. She wanted to understand why her blood sugar was rising while she slept, despite doing everything she had been told to do. I began by looking at her glucose records. Months of neatly logged numbers told a very clear story. Her bedtime readings were reasonable. Her morning readings were consistently high. That alone told me something critical was happening overnight, not during the day. I want you to understand this clearly. Overnight blood sugar elevation is not a personal failure. It is almost always driven by predictable physiological processes. The problem is that many patients are never taught about them. Your body does not shut down metabolically when you sleep. In fact, it becomes hormonally active. Several hormones that influence blood sugar are released on a schedule that follows your internal clock, not your eating habits. One of the most important concepts to understand is that your liver plays a major role in overnight blood sugar levels. Even when you're not eating, your liver is capable of releasing glucose into your bloodstream. It does this to keep your brain and vital organs supplied with energy. In people without diabetes, insulin carefully balances this process. In people with diabetes, that balance is often disrupted. As we age, insulin resistance tends to increase, and insulin production may decline. That means the same hormonal signals that cause no problem in a healthy person can cause significant glucose elevation in someone with diabetes, especially overnight. Margaret assumed that if her blood sugar was acceptable at bedtime, it should be lower in the morning. That assumption makes sense logically, but physiologically, it's often incorrect. Overnight glucose levels can rise even in complete fasting conditions. This misunderstanding leads many patients to blame themselves. They restrict food further. They skip dinner. They feel guilty. But none of those actions address the real issue. Another critical problem is how blood sugar is typically monitored. Most patients only check twice a day, at bedtime and upon waking. That leaves a massive blind spot. Without data from the middle of the night, you're only seeing the beginning and the end of the story, not what actually happened in between. This is why so many treatment decisions are made with incomplete information. A high morning reading is often interpreted as not enough medication, when in reality, the cause could be something entirely different. In Margaret's case, increasing medication without understanding the overnight pattern was actually worsening her quality of life and increasing her fear, without solving the problem. And here's the part one want you to hear clearly: there is more than one reason blood sugar can rise overnight. Not one. Not two. Several. Each one has a different cause and requires a different approach. Treating the wrong cause can make blood sugar control worse, and in some cases, dangerous. That's why guessing is not an option. Before you can fix overnight blood sugar elevation, you must understand which mechanism is responsible in your body. This is the foundation of safe, effective diabetes management. In the next part, I'm going to explain the first and most common mechanism, a process that affects a large percentage of people with diabetes and often goes completely unrecognized. Once you understand it, many things you've been struggling with will finally start to make sense. The most common reason blood sugar rises overnight is something called the dawn phenomenon. And despite how often it affects people with diabetes, very few patients are ever taught what it actually is or why it happens. The dawn phenomenon is not caused by food. It is not caused by late-night snacking. It is not caused by lack of discipline. It is driven by your body's natural hormonal rhythm. Every human being, diabetic or not, has an internal clock known as the circadian rhythm. This clock controls when certain hormones are released, including those that regulate sleep, wakefulness, and energy production. In the early morning hours, usually between 4 a.m. and 8 a.m., your body begins preparing to wake up. During this time, your adrenal glands release higher levels of cortisol, often referred to as the stress hormone, but more accurately described as a wake-up hormone. Cortisol tells your body it's time to become alert and energized. Here's the problem: cortisol directly raises blood sugar. Cortisol signals your liver to release glucose into the bloodstream. It does this in two ways. First, it tells the liver to break down stored glycogen into glucose. Second, it stimulates the production of new glucose from amino acids and other substrates. This process is completely normal and necessary. In a person without diabetes, the pancreas responds immediately by releasing insulin to match that glucose release. Blood sugar stays stable. In a person with diabetes, especially type 2 diabetes, this balance often fails. If your body is insulin resistant or your pancreas cannot produce enough insulin quickly enough, the glucose released by your liver has nowhere to go. It stays in the bloodstream. Blood sugar rises, sometimes dramatically, before you ever wake up. This is why someone can go to bed with a blood sugar of 140 and wake up at 180 without eating a single bite of food. The dawn phenomenon is not subtle. For some people, it raises blood sugar by 20 points. For others, it can raise it by 50 to 100 points every single morning. And because it happens while you're asleep, it feels mysterious and unfair. What many people don't realize is that starting your day with elevated blood sugar doesn't just affect that morning number. It affects your entire day. When you wake up high, every meal pushes glucose even higher. Your body spends more time above target ranges, increasing cumulative damage to blood vessels, nerves, kidneys, eyes, and the brain. In the next part, we're going to talk about another overlooked contributor to overnight glucose elevation: evening meals and medication timing, and why reasonable dinners can still cause problems hours later. Not all overnight blood sugar elevation is driven by hormones alone. For many people, the issue begins at dinner, but not in the way most expect. I often hear patients say, "I eat a healthy dinner, so it can't be the problem." And in many cases, that's true from a nutritional standpoint. The issue isn't always what you eat, but how long your body continues processing it. Digestion does not stop when you fall asleep. When you eat carbohydrates, your body breaks them down into glucose, which then enters the bloodstream. This process can take much longer than most people realize, especially when meals include a combination of carbohydrates, protein, fat, and fiber. Simple carbohydrates tend to raise blood sugar quickly and then fall. More complex meals digest slowly and can release glucose over several hours. That means blood sugar may continue rising well after bedtime. Here's a common scenario I see. A person eats dinner around 7 p.m. They check their blood sugar at 10 p.m. and see a reasonable number, maybe 135 or 145. They go to bed believing their glucose is under control. But what they don't see is what happens at midnight. As digestion continues, glucose from that evening meal keeps entering the bloodstream. In someone with diabetes, insulin response may not be strong or fast enough to handle it. Blood sugar peaks during sleep, sometimes reaching its highest point hours after the last bite of food. Sleep is not just rest. It is an active metabolic state that plays a powerful role in how your body regulates blood sugar. When sleep quality is poor, glucose control often suffers, especially overnight. During healthy sleep, your body cycles through different stages, including light sleep, deep sleep, and REM sleep. Deep sleep is particularly important for metabolic health. During this stage, cortisol levels are lower, inflammation is reduced, and insulin sensitivity improves. When sleep is disrupted, that balance is lost. Poor sleep increases cortisol and stress hormone release. It worsens insulin resistance. It signals the liver to release more glucose. Even a single night of inadequate sleep can measurably raise blood sugar the following day. Chronic poor sleep compounds the effect. This matters because sleep problems are extremely common in adults over 60. Pain, frequent urination, medications, anxiety, and irregular sleep schedules all fragment sleep. Many people believe this is simply part of aging, but metabolically, it has real consequences. One condition deserves special attention: obstructive sleep apnea. Sleep apnea occurs when the airway repeatedly collapses during sleep, briefly stopping breathing. Each pause may last 10 seconds or longer and can occur dozens or even hundreds of times per night. Every event triggers a stress response in the body. Oxygen levels drop. The brain panics. The nervous system releases adrenaline and cortisol to force breathing to resume. Each of these stress surges raises blood sugar. Over the course of a night, repeated apnea events can drive significant glucose elevation, even in someone who hasn't eaten and is taking appropriate medications. The person usually has no awareness this is happening. Sleep apnea also worsens insulin resistance and promotes inflammation, creating a double metabolic burden. This is why many people with untreated sleep apnea struggle with morning hyperglycemia that seems impossible to explain through diet or medication alone. Common warning signs include loud snoring, gasping or choking during sleep, morning headaches, dry mouth, and persistent daytime fatigue despite adequate time in bed. But some people have sleep apnea without obvious symptoms. If overnight blood sugar remains elevated despite reasonable meals and appropriate medication, sleep quality must be considered. Treating sleep apnea, most commonly with CPAP therapy, has been shown to improve fasting blood sugar and overall glucose control in many patients with diabetes. Addressing sleep is not an optional lifestyle detail. It is a core part of metabolic health. This brings us to an important conclusion. There is no single cause of overnight blood sugar elevation. Most people have more than one mechanism operating at the same time: hormonal rhythms, medication timing, digestion, and sleep quality all interacting together. That is why simple advice rarely works. In the final part, I'm going to explain how to identify which mechanism is affecting you and what data you need before having a meaningful conversation with your doctor. This step is where confusion turns into clarity. By now, you understand something most people with diabetes are never taught: high morning blood sugar is not a mystery, and it is not always a sign that you are failing. It is usually the result of identifiable physiological processes that occur while you sleep. The challenge is that you cannot identify what you do not measure. Checking blood sugar only at bedtime and in the morning leaves a critical gap. You see the beginning and the end, but not what happens in between. To truly understand your overnight pattern, you need data from the middle of the night. The monitoring approach I recommend discussing with your doctor is simple but powerful. For 1 week, check your blood sugar at 3 specific times. First, at your usual bedtime. Second, around 3 a.m. Third, when you wake up in the morning. Yes, waking up at 3 a.m. is inconvenient. But you're not doing it forever, just long enough to reveal the pattern. Those three numbers tell a story. If your blood sugar is stable at bedtime and 3 a.m. but rises sharply by morning, this strongly suggests the dawn phenomenon. Hormonal signals are driving liver glucose release in the early morning hours. If your blood sugar drops low at 3 a.m. and rebounds high by morning, this points toward the Samajai effect. In this case, nighttime hypoglycemia is triggering a stress response that overshoots. If blood sugar is already elevated at 3 a.m. and remains high in the morning, prolonged digestion from evening meals, bedtime snacks, or medication timing may be contributing. If readings are erratic or consistently elevated despite reasonable patterns, sleep quality or sleep apnea must be considered. Each pattern leads to a different conversation with your healthcare provider. And that is the goal: better conversations, not self-treatment. When you bring this data to your doctor, you're no longer guessing. You're collaborating. You're asking informed questions instead of receiving automatic adjustments. This is exactly what happened with Margaret. Once she understood her pattern and worked with her endocrinologist, her morning blood sugar improved by over 40 points. More importantly, her fear disappeared. She stopped blaming herself. She finally understood her body. And that understanding is powerful. I want to be very clear one last time. Never adjust your medications on your own. Never change insulin doses without direct medical supervision. What I've shared is meant to educate, not replace professional care. But education changes everything. When you understand why something is happening, you stop feeling helpless. You stop assuming the worst. You stop thinking complications are inevitable. Diabetes management is not about perfection. It's about awareness, patterns, and partnership with your healthcare team. If this series helped you understand your overnight blood sugar for the first time, I encourage you to share it with someone who might be struggling silently. There are millions of people waking up every morning discouraged by numbers they don't understand. You don't have to be one of them. Take care of yourself. Gather the data. Ask better questions. And I'll see you in the next video.